If we talk about imaging for patients with COPD, there is mainly two exams that we often perform. And one is the usual X-ray, which is a test that is often performed in the acute setting and that is considered very useful for a differential diagnosis. We can diagnose pneumonia from an acute infection, we can diagnose a pneumothorax, for instance, but it is very insensitive to detect the disease and to learn more about the disease and treatment strategies. For that, we need more detailed testing, and that's the CT scan. So a CT scan for patients with COPD is not the first examination that we perform. It is often performed on specific indication. Although it's a very sensitive test and it may detect COPD even up front of a diagnosis with spirometry. But oftentimes it is on indication, and then mainly in the case that the patient is uncontrolled. Having more symptoms of cough, sputum, less exercise, tolerance. These are all reasons why your clinician would consider a CT scan. And on a CT scan, you can evaluate the airways and the lung tissue itself. And with the airways, we then make the differential diagnosis, whether this is all air trapping, air trapped behind closed airways, whether there is mucus plugs obstructing the airways, or whether there is dilated airways, which we call bronchiectasis. The lung tissue itself is mainly focusing then on tissue destruction, which we call emphysema, and which we can also quantify and use as a marker to follow up and to detect disease progression. Some patients also qualify for specific screening programs because CT scan is very sensitive also in detecting lung cancer. And as we know, patients with COPD are highly at risk for getting lung cancer. So CT scan is widely available in most healthcare systems of Western society, but it's a quite expensive test. But dependent on the reimbursement, the costs for the patients are not that high. CT scan is an easy, quick test, but can only be performed in a hospital setting. Still, the GP, your GP, and the pulmonologist are both able to request for a CT scan on indication. CT scan is a very easy test to perform, but it's only executed in hospitals. So the examination usually takes 5 minutes, where you get a total scan of the chest. And the risk for this procedure is estimated very low. There is irradiation exposure, but this is probably only to consider important with regular CTs in follow-up. For this CT scan that we consider in COPD patients, there is no preparation needed as we do most of the exams without any contrast.